First of all, ENET's really started clinical trials in the area of neuroendocrine tumors. So they're really very, very good. I think that's on the same standard of clinical trials. There's a great body of people now in North America as well, as part of what's called the North American Neuroendocrine Tumor Society, or NANETS, and they're doing great work. So very good trials over there, very good trials in Europe. We're starting up a couple of trials after Christmas here as well, and we're a smaller group, but if we have good quality questions, we can recruit people, that would be good. Barbara?
Yeah, I think the Americans are very good at performing clinical trials. If you look at publications from Dana-Farber and MD Anderson, they have a lot of patients in the RADIANT-3 study and other studies. So, but I don't know, for patients who are not seen by these specialized centers, I don't know actually. If you look at survival rates from the SEER registry, which is a population-based registry in the US, the survival for patients with neuroendocrine tumors is much lower than in specialized centers in the US and Europe. So it depends on where the patient goes.
Derek was in Memorial in New York. It's fantastic. It's an unbelievable place. And there are places like in Boston. But then your sort of Conor Gardner, even University Hospital, would often not be on a par. Now, I'm exaggerating a little bit. So maybe sometimes there's a little bit of overemphasis on the results that are coming out from the big groups.
In these big cancer centers in the United States, patients to get onto clinical trials are often super fit. They're very educated, very motivated, surrounded by fantastic supports, and they're very super selected. So sometimes a lot of these results aren't extrapolatable to your average patient, which I could easily be, who's not as, you understand what I'm saying. So they're very selected patients in these studies, so it may not be applicable to the average patient.
That's actually, if you go into the ASCO website and look at the instructions for clinical trials, and it says at the end, it's very good to include patients in true clinical trials, but please beware that in the clinical trials that have been performed, there's a very big selection of patients. It's not, you cannot apply it in your everyday clinic. In your everyday clinic, each patient is unique. You have to think one or two more, three more times.